It's not just radio, it's Rockland World Radio. RocklandWorldRadio.com.
Good evening, and welcome to Dialogues with Dan, heard on Rockland World Radio every Tuesday evening at 6:30 p.m. Eastern Standard Time. You may check out the archives by visiting the program page located off the menu bar. And now, the host of Dialogues with Dan, Mr. Dan Windheim.
Thanks, Richard. Hi, everyone. This is Dan, and guess what? We have a live one tonight. I'm speaking with an old friend. Well, a friend. I won't say she's old. A friend from high school. I'm speaking with Megan Brown Kelly from Westchester. Hi, Megan. How are you?
I'm great, Dan. Thanks for having me here tonight.
Oh, my pleasure. Maybe we could start by you telling everyone why you're here and a little about your background and what we're discussing tonight.
Sure. Well, Dan, you know from high school that I spent a couple of years during 8th and 9th grade challenged by an illness. When I was 12 turning 13, one day I was in my front yard with my good friend Nancy Young Taylor, and she was a great gymnast, so she was going to teach me how to do cartwheels and backflips and all kinds of fun things. And I really couldn't do it. I wasn't quite as talented as she was, but we were laughing and having a great time doing it anyway. And then all of a sudden she looked at me and said, "Megan, something's wrong with your face. We better go in and show your mom." And we went in, and she said, "Mrs. Brown, look at Megan's face. Something doesn't look right." And she said, "Smile for your mom." And I thought I was smiling, but I wasn't, because none of the muscles in my face were moving anymore. And so then began my journey with the medical community, trying to figure out what was the matter with me. And my parents took me from doctor to doctor, trying all kinds of tests and examinations to see what it was. And, you know, back in 1970s, this was not as easy as it is now. There was no internet. There was no way to really research things on your own except to go to the public library, which my mother did faithfully, looking through every type of medical book she could to try and find something. And we would go on a lot of different medical procedures and tests, and it was very painful. I had a lot of tests done to me that caused physical pain, that caused fear. And, you know, back in those days, there wasn't sort of the supportive environment that there is in hospitals now. And, you know, parents were often dismissed from the room so the technician could perform the test on you alone, whether it was sticking needles into you or electrical impulses or whatever to test your nerve muscle reactions. And after about a year of this, you know, my mother, in her desperation to find out an answer, really didn't know what else to do. So she orchestrated a mass for me at St. Anne's Church in Nyack, and the congregation was full, and I was horrified because I was 13 years old and I was already tall and skinny and gawky, and they sat me up on the altar while the entire place prayed over me. And I thought it was very embarrassing, as any 13-year-old child would. But nonetheless, my mother thought this would help, and so everybody came up and laid their hands and said a prayer. And, you know, at the end of the night, I thought, well, I'm not cured, no miracle here.
Yes.
But lo and behold, about 2 days later, my mother, in one of her journeys to the library, opened up the Reader's Digest and saw an article called "I Am Joe's Thymus." And in reading that article, she learned about a disease called myasthenia gravis, which is an autoimmune disease where the transmissions from your nerves to your muscles are interrupted when your thymus is not functioning properly. And she took that magazine to the next doctor's appointment and said, "This is what my daughter has." And the doctor looked at it and said, "I think you might be right."
Yes, that must have been a very scary and crazy time for you.
It was really scary and very challenging. You know, in addition to all of the medical procedures that I had to undergo and being so frightened about that and having so much pain from that, there was another whole aspect of it, which was the psychosocial implications of it. In going to school, the symptoms that I exhibited were droopiness of the eyelids, almost to a closed position, no control over the muscles in my face, so I couldn't smile. I couldn't speak properly because when you can't form your lips and blow breath out, and the uvula in the back of your throat, that little punching bag, isn't really closing off your sinuses for your speech to come out properly, it can be very difficult to understand somebody speak who's got all of those impediments. So I endured a lot of teasing and bullying in class. It was very embarrassing to have to get up and read out loud or to answer questions. And I felt really ostracized and isolated. Many of the other kids in the school weren't sure what was going on with me. And if they didn't know me, they weren't sure what kind of cognitive delays I might have. Because when you're not smiling and you're not reacting and you can't speak properly, sometimes people assume that you don't know what's going on or that you're not smart or that you've got some kind of a delay.
Yes, but myasthenia gravis does not affect intelligence.
Not at all. Not
Yes.
at all. So my brain was functioning completely normally, but my
Yes.
nerves and muscles were not. And it was very socially isolating. And I spent a lot of time questioning God, why did this happen to me? Why am I going through this? Why have my friends sort of started to move away from me because they didn't know how to react to what was happening to me? I'm sure it was scary for them. At the time, it felt lonely and isolating for me. But now as an adult, I look back and I think we were all just kids. We were just teenagers, and nobody knew how to handle something like this.
But at that time, it must have been life-shattering.
Yes, it was really, really difficult, to lose a lot of friends and to feel like you were constantly being laughed at. I remember kids laughing at me in class when I would speak, or, not wanting to sit with me at lunch, all the kinds of things that happen with kids when somebody is different. And that was really challenging. So after my mother, sort of diagnosed me with the doctor, they tried about 6 months of medication trials. That's the typical course of action, is to use different medications that will regulate your autoimmune system and improve those transmissions between the nerves and the muscles. And that wasn't having any effect for me. And some of the risks that can happen is, if your muscles are not working properly, you're not chewing your food well, your throat muscles aren't working properly, you can choke a lot, your respiratory can be compromised, you have trouble breathing. Your overall health starts to become really compromised. And then the more you're fatigued, the more your symptoms are evident and you have more challenges. So after about 6 months of the medication trial, a year and a half into my disease process, the doctors decided that a thymectomy, the removal of the thymus, would be the best course of action. Now, at that time, they told my parents there's only a 30% chance that this will cure her, and there is a chance that she could die through this intervention because her body is so weak. And I, in fact, did spend 3 weeks in intensive care, intubated, with a breathing tube, and awake, which is an extremely scary experience for anybody, but especially as a child, to be awake and alert and hear everybody around you while you can't speak yourself because you have a breathing tube down. And you have to have constant suctioning to clear the fluids out of the breathing tube, which can be traumatizing and painful if not done really carefully. And in fact, one time during my stay in the ICU, the intensive care unit, while they were suctioning me, my breathing tube came out and I coded and was gone for, a little bit of time. And the last thing I remember the nurse saying as I started to lose consciousness was to the doctor, "Oh my God, she's turning blue." And then I remember not remembering anything else after that. And they revived me and brought me back, and I stayed about another week and a half in the intensive care unit. And then I went home, and within a few weeks or a month, my symptoms had resolved, and physically I was back to normal, but I still had some emotional scars from this whole experience.
Yes. Would you have some maybe tips or suggestions for others dealing with MG and the effects? as a young person or as an older person, isn't it true that people age 60 are affected by MG or could be affected?
Yes, to my knowledge, it's more common in adults, 40 to 60 and older. It's not as common in young children. But I think, for the listeners, if you're suffering with something like this, is to really look at your lifestyle and how you can best take care of yourself for the optimum outcomes. So whether it's staying rested, maintaining your medication regimen, exploring all your options. Thymectomy is not the option for everybody. There's only certain people that really have that kind of intervention. So you want to explore all your options with your physicians and make sure that you're making a well-informed decision about your treatment.
Yeah.
For people that are interacting with people that have myasthenia gravis, it's important for them to understand that it is a neuromuscular impact, but not a cognitive impact. And you really need to be aware of that and be supportive to that person, whether it's a young person or an adult, to be supportive and tolerant of things like a speech impediment, patient with someone who's having
Yes.
difficulty speaking, patient with somebody who might take a little bit longer to do something because they're weak. I remember one time when I was in the hospital, at that time in the 70s, they never really invited parents to stay over in a hospital with their children at night, which is very common practice now. So I was alone a lot at night, and I remember an orderly coming in to clean my room, and he was trying to be friendly, and he said, "Hi, how are you, little lady?" or something like that. And I just sort of mumbled to him because I couldn't smile, and I couldn't really talk to him because of my speech. And he kept saying, "Don't look so sad. It's not so bad. Come on, give me a smile." And, he had a good intention, but for me it was very frustrating because I couldn't smile at him and I couldn't talk to him in the way that he was trying to engage me.
Yes.
So just sort of being mindful that, people that are going through a medical challenge or have a disability, to be patient with them and to not have any set expectations of them and meet them where they're at.
Yes. Do you have brothers or sisters?
I have 2 older brothers.
And how was their, impact, like, between you and them?
They are 5 and 10 years older than me, so at the time, my middle brother was in college, so he was
Yes.
very much involved in his college life, and my older brother was a young adult and involved working and in his adult life. But they were very supportive of me and loving, and we had a typical brother-sister relationship. We teased each other, but in the brotherly, sisterly kind of way. And we had a very nice relationship. And I do say I had, several friends that had been lifetime friends that stuck with me through it all and were always there for me, and were very patient and tolerant of the changes in my affect.
Yes. And you had the operation. So your residual effects, they're not apparent.
I'm completely cured,
Yes.
thanks to the miracle of my mother finding that article.
Yes. So you would say MG is a life-changing event. Maybe you could talk about, as a young person and maybe a little older and maybe a little older,
Sure.
the effects.
Sure. Having myasthenia gravis as a young teenager, at the time it felt devastating. I felt very alone, I felt very scared, and I felt very let down by God. That was really how I felt about it. And so after the episode of having that illness for a year and a half was over, I probably suffered from low self-esteem from all of the teasing I endured, and I was extremely shy, and I had to find friends that would accept me and support me where I was at, which at that time was this shy, young, timid girl. But I did, through those friendships, through people in Nyack High School stage crew and the drama club and all that, was able to come out of my shell and feel more confident. And then, I also remember as a young girl, even before my illness, during my illness, and after my illness, there was a family on my street on Babbling Brook Lane in Valley Cottage where I grew up the Gerensers, and they had 4 young girls. And their youngest girl had cerebral palsy and mental retardation. And I used to babysit for them. And even while I was challenged with my illness, I still babysat for them. And I felt so comfortable in their family because they had a disabled child. And they were so loving and supportive of my condition. And I think that experience, plus my own medical challenge, is what really led me in college to choose to go into the field of special ed originally. And
Yes.
I became a special ed teacher and worked as a special ed teacher for 15 years. Really because I had this affinity for helping children with challenges. And during that career, I went back to get my master's degree in special education. And while I was doing it, somebody approached me and said, you know, there's this other field that you might not be aware of that I would like to introduce you to because I think you would be good at it. And this person knew nothing about my history. And I said, what is it? And she said, it's child life. I had never heard of child life before. I had no idea what she was talking about. And so I decided to sign up for a couple of classes at Bank Street College of Education in Manhattan, where I was getting my degree in child life. And during that time, my advisor, Elsbeth Pfeiffer, who was one of the matriarchs of child life in New York City, said to me, you've been teaching for a long time, so instead of doing an internship in teaching, why don't you do an internship in child life for the whole year and see what you think about that field? So that's what I did. Now, ironically, when I went to Montefiore Medical Center, where I did my internship, which is where I currently work, I, within a few days of going there, met a young girl who was the age 13, which is the same age I was when I was ill, and she had myasthenia gravis. And I had never in my life met anybody with myasthenia gravis before.
Right.
And at this point, I was like 32 years old, and I hadn't met anybody else with this disease. And she was in the hospital to have a thymectomy. And I couldn't believe that my life had come full circle. Now, in the field of child life, it is standard practice not to discuss your own personal medical history with your patients. So I didn't do that. But I think my experience allowed me to have a certain kind of empathy for her. And many people in the field have had either their own medical experience or a family or loved one has had a medical experience that has prompted them to come into this field. So what we do in child life is we teach children about their medical illness. We teach them about all the procedures that they'll have while they're in the hospital. And we use a variety of tools for coping techniques. Most of that is done through play, because play is the language of learning for children.
Yes.
So no matter the age, you can find a developmentally appropriate modality of play or art or music that you can use to help the child understand about what's going on for them and normalize that experience as much as possible. In doing that,
Megan,
yeah.
so would you say that that course or study, child life, is it really a well-known course of study? Is it widespread?
Well, currently, when I was a child, I don't remember there being any child life specialist, and nobody supported me or explained anything to me
Yes.
other than what would be standard practice for the doctor to come in and say, this is what's the matter with you and this is what we're going to do. And they would say it usually in doctor language. Child life specialists really are specially trained in the developmental levels of children and the language to use and the play techniques to use to help children understand that. Currently, there's about 4,000 child life specialists in the field. And they're spread throughout the world, but mostly concentrated in United States and Canada. And this is an invaluable role, not only in supporting the emotional response that a child has to illness, but also in helping them to continue typically developing. I mean, I talked before about my own experience and how interruptive it was to my social development and the impact it had on my self-esteem and my confidence and everything growing up. Well, child life specialists, in addition to all the clinical work that they do that I described, they also offer social opportunities for children in the hospital through recreation. And that's where, if you're constantly in the hospital with battling a medical illness, you're not having a chance to do all those typical things that kids do, like be a cheerleader or be in the drama club or be on a football team or something. So that's where kids learn how to problem solve and negotiate and share and collaborate. You don't learn those things if you're constantly in and out of the hospital. So child life has to support that development as well as nurturing the hospital experience for the child and their family.
Yes, so you would definitely recommend anyone listening that they get connected with a child life specialist?
Absolutely. If you are bringing your child to a hospital for any kind of procedure, intervention, surgery, call and ask them, do you have a child life specialist that can help prepare my child? You know, sometimes parents are hesitant because they themselves are scared and they don't want to tell their children too much because they're afraid that that will increase their fear. When in fact, most of the research shows that preparing a child in a developmentally appropriate way, telling them what they need to do, know. For example, a 2-year-old who's going for surgery doesn't need to know all the details of the surgery.
Yes.
When a child life specialist is preparing a 2-year-old for surgery, all they're going to do is introduce them to the mask that the doctor's going to put over their nose and mouth to go to sleep. So they can play with it. They can put it on their teddy bear. They can put it on themselves. They can put it on their mommy. They can smell it. And a lot of the pediatric masks smell like bubble gum or strawberries or something. They get used to it, and then they don't feel so scared when the doctor comes at them with that mask. Whereas a teenager who's having a surgery, like I was, I would have wanted to be prepared for the fact, and I was not prepared for this, that when I woke up, I would have a breathing tube. I would have chest tubes that were helping the liquid come out of my chest cavity where my surgery was. You know, this particular surgery, they have to open your entire chest, just like an open heart surgery, and go behind your heart where the thymus is. So it was a very complicated surgery. Nobody prepared me for all of that. So it was very scary to wake up, have a breathing tube, you can't talk, you have chest tubes, you're in pain, and you have a huge scar down the middle of your chest that nobody told you were going to have. You know, for a child life specialist now would prepare a teenager for all of that and let them know what to expect so they could be less afraid. So I would advise parents, you know, prepare your children yourself, be honest with what they need to know, and engage a child life specialist at the hospital to prepare them as well.
Yes. So you definitely realize, or you agree, that people in life are much more aware of what's going on in a hospital, and that they're much more assertive to getting what they need done.
Yeah,
Don't you think so?
Yeah, these days, you know, most hospitals these days are really embracing this philosophy of family-centered care,
Yes.
which really involves the family as part of the medical treatment team and really relies on the parents to help them know what works for your child and what doesn't work for your child, really involves the child in the process and gives them a little control over what's going on. When you think about a child in the hospital, there are so many things out of their control. You know, when they have to get up, when they have to have blood drawn, when they eat their meals. So it's good to be able to give them a little bit of control. So maybe they can't control whether or not they need a needle, but you could give them the choice, do you want to sit up or lie down while they give you the needle?
Right.
Then they feel like they're part of the team.
Yes, maybe we should just cover that. Well, you had mentioned the causes of MG, that there's it. Maybe you could say that again.
Sure. I mean, it's really caused by an autoimmune disorder where, as I said, the transmission between the nerve and the muscle is not making a clear connection.
Yes.
So your brain is telling you to smile, and that message is going, you know, to your nerves, but somewhere between the nerve and the muscle, it's getting interrupted.
Yes, and the occurrence of MG. I had read that it's 7 people out of each 10,000.
Yeah, I don't know if that was the statistic when I was a child, but because, you know, that seems like a more frequent occurrence than I, you know, am aware of, but I think now it's much more accurately diagnosed. You know, when I was young, they didn't have the kind of MRI imaging and the types of blood tests that they might do now. A lot of the tests that would diagnose it weren't available. And oftentimes it would be confused with other neuromuscular disorders. And they might start going down the wrong track of treatment thinking that maybe it's, you know, muscular dystrophy or multiple sclerosis or something else. And now I think there's more awareness about it and it can be more accurately diagnosed quickly.
Sure. And as far as support groups, you didn't have time to look up any actual groups, but you said if you go on the internet, there are many groups.
Absolutely. Yeah, I mean, there was no support groups when I was a child. There was nothing to really support the families or the child going through that. But now, with the World Wide Web, you can go on and Google myasthenia gravis, and you're going to get a lot of associations that will come up that are organizations that offer support for neuromuscular disorders.
Yes. And some of the situations that exacerbate MG, I had seen that sunlight and anger, stress, you had mentioned stress, and the exposure to chemicals.
For me, the exacerbating factors were fatigue and stress. So if I was overly tired, then I would get even more weak. Or if I felt stressed, like if I had to get up and speak publicly, it would exacerbate. I remember never wanting to have my picture taken because I couldn't smile. And photographers would be saying, come on, give me a smile, whether it was a school photographer or, just a family friend who wasn't aware of, that inability. And that would cause me more stress and I would feel even more weak at that point.
Yes. So would you be able to maybe give five things that anyone out there might be able to be helped by? If they have children or friends, maybe we could mention those 5 keys.
Sure. In terms of supporting children through hospitalization and medical experiences?
Or, like you said, it might not be just children.
Right. Children or adults.
Yes.
I mean, it's really important to be open and transparent about what's happening. So, whether you're dealing with a child or an adult, when you're having a medical experience, you want to meet that person where they're at. You want to assess their knowledge base and make sure that they have enough information to feel comfortable with that. You want to provide them with the best coping techniques possible. Many of us in the child life field get trained in what they would refer to as complementary therapies, things like guided imagery, Reiki, massage techniques, things that will help somebody reduce their stress level and cope more effectively with medical interventions. So, learning how to do that, I mean, for a child, really for any age, whether you're a young child or a middle school child, a teenager or an adult, a technique like guided imagery, teaching somebody how to use their imagination to manage their pain and anxiety is an amazing tool.
Is that what guided imagery is?
Yes, we really can teach somebody how to get themselves into a state of relaxation and how to use their own imagination to take themselves into a trance that will allow them to feel more calm and more supported during any kind of situation that might arise. And the great thing about teaching a skill like guided imagery is that once people learn it, they have it with them always.
Sure.
So unlike, maybe, something like aromatherapy, which is also a great, technique, but you may not always have an aroma available to you. You're riding the subway, you're feeling anxious about something, you may not be able to take out an aromatherapy candle or a scented or whatever and calm yourself. But guided imagery is all in your mind. So you can bring that and bring yourself to that place of relaxation at any time.
Let me ask you, are there any maybe courses or groups that go to schools and maybe educates the students to know that other students might be dealing with MG and that this is what is happening? I mean, that might have been very helpful for you.
Yeah. I work at the Children's Hospital at Montefiore in the Bronx now. I'm the director of Child Life there, and one of the programs that we offer there is a school reentry program for kids that have been out of school because of a medical illness and then are going back into school. And we can send a child life specialist and a social worker and nurse out to the school if the child wants that. And we can discuss with their classmates what is going on and what changes have happened to that person and why, and really help clarify for their classmates what to expect from this friend of theirs.
Yes.
And that makes them feel more supported. And it also, we can work with the education staff to help them understand the impact it might have on their learning or any accommodations they might need in the classroom to make sure that that reentry is as smooth as possible.
Yes. How about actually help teaching the actual child patient that they could educate others and tell them that this is what's happening to me.
Absolutely.
And build up their confidence.
Absolutely. One of the techniques that we often use with our patients is to teach them self-advocacy.
Yes.
Teach them how to feel empowered, that if someone, says to them, why do you look that way or why are you acting that way, that they can say, well, I have this illness, and they can explain it. And
Yes.
we can help give them the language that feels comfortable for them and that their friends will understand to explain it, and sometimes even, script it a little bit in just a 1 or 2 line sentence so that you can say it and then move on and not have to dwell on it if you don't want to.
Sure. Yep. In our last 2 minutes, maybe I'd like to ask you to speak about being an adult and your own family, and maybe how you have dealt with this with your children. Did you share with them what you went through?
Sure, they've heard the story of what I went through just like I explained it tonight. I think it's hard for them to conceptualize what that was like for me to go through it, because now they see before them a mother that's confident and active and, has a job at a big children's hospital where I'm able to have, 19 child life specialists and music and art therapists working with me to support children and families. And they may not realize, the challenges that I went through to get to this place where I decided I could take my challenge as a child and turn it into something positive to help many, many other families.
That's excellent.
It's the best way to look at it. If you face a challenge like that, is how you can turn it around and make it something positive.
Yeah, it sounds like this experience has made you a stronger person, a better parent, or a strong parent, and a great adult. I'm very happy for you.
Thanks, Dan.
Yeah, I'm so glad you joined me for this half hour. This has been Megan Brown Kelly on Dialogues with Dan. Well, everyone, have a great week. Peace.
Thanks so much.
You're welcome.
It's not just radio, it's Rockland World Radio. RocklandWorldRadio.com.